When you're placing an IV catheter, you're first going to want to gather your materials. So I don't have all the materials that I would use, but what I would use, I would get clippers to clip the hair, alcohol to scrub, chlorhexidine to scrub. I would get my tapes ripped, so I would do one long skinny piece, one long thick piece with a notch, one half long piece to wrap at the end, and then one to wrap the T-port. But I'm not using a T-port, I'm using an injection cap, so we might not use this piece. I would also get your conforming gauze, injection cap, vet wrap, and then here I have the catheter taped on to the fake vein so I can kind of show how it would be into the vein. So the first thing you're going to want to do is to clip your hair around the limb distal to the hock, and you're going to want to do about 2 to 3 inches of hair, creating a window all the way around the limb. This is so you don't touch the hair to the catheter port, which can cause contamination, and also so you're not pulling or tugging on the hair, which can cause pain when you're taping. So you're going to want to prep yourself first. You're going to want to take your catheter out of its container and examine it and make sure that it slides off the needle easily and it's not burred at the end. You're going to want to rip your tapes. You're going to want to take your injection cap out, but you would leave it in its packaging to make sure it stays sterile. But I don't have the packaging because I've used this to practice before. So in theory, it would be in the plastic still to keep the end sterile. So you're going to want to make sure that your restrainer has a good hold on the head and the arm. And you're going to take your alcohol, your 3 alcohol wipes, and wipe the area, and take 3 Chlorohex area wipes and wipe the area, and then you're going to wipe those in concentric circles starting from the inside going out, and you're going to want to do that for a contact time of about 3 to 5 minutes. So with the patient in sternal recumbency, you're going to have your assistant hold off the vein. They can do this by placing the palm of their hand behind the elbow and placing the thumb over the top of the limb. Then the holder can rotate their hand slightly outward to line the vessel up properly. So you're going to let the holder know that you'll be inserting the catheter, and with the bevel up, you're going to insert the catheter at about a 30-degree angle on the cranial aspect of the forelimb into the cephalic vein. Once you see the blood begin to enter the catheter, so a flash of blood, you're going to slide the catheter or feed the catheter off the needle and into the vein. You're going to instruct the holder to stop applying pressure to the vein at this point, and you're going to remove the end cap of the catheter and place either the T-set or the injection cap onto the end of the catheter. So without letting go of the catheter or the leg, you're going to want to start your taping. So once you have your catheter in place, you're going to want to apply your injection cap. So you're going to just twist that on. And then you're going to want to keep your thumb on the base of it in order to keep the catheter in place. But once that's on, you can start your taping. So you're first going to take your long skinny piece and slide it under the catheter. So it's nice and snug up right at the base. And then you're going to take that and wrap it around the limb. You're then going to take your second piece, which is your big fat piece with a notch, and do the same thing. You're going to slide this up under the catheter, nice and snug. And then you're going to wrap around the limb. You want to make sure that you don't cover the injection cap so it is still able to be removed. So when you go to plug in your IV fluids, you can get to it still. So then once you have those in place and your catheter is stabilized, you're going to use your conforming gauze and wrap the leg. So starting at the bottom, you're going to wrap, and in theory I would have a foot down here I can hold on to, but you're going to wrap around the base and up the leg, and then again back down, because what goes up must come down. And then you're going to do the same thing with your vet wrap. So you're going to take your vet wrap, you're going to start at the bottom and work your way up the limb. Whoops. And you're going to want to make this stretched out before you use it because it does get kind of tight. So I'm going to just rewrap that. And you're going to work around the limb. Big thing with the vet wrap and the conforming gauze is you're going to want to make sure that there's no crinkles or wrinkles in it because that can be irritating to the leg. And then, once you have your catheter all wrapped, you're going to take your last little skinny piece, slide it up under the catheter, and cross it over. So once you have that last piece of tape on, you should be good to go. You can flush the catheter to ensure patency, but from here you would attach a T-port to then attach some IV fluids. This needs to be changed every 72 hours and replaced, and the bandage needs to be changed once a day to make sure it's clean. But the catheter, if staying in for over 72 hours, needs to be replaced. Make sure the bandage around the catheter stays clean and dry, and if at any point it is soiled, it needs to be changed immediately so it doesn't cause any sort of wound.